So let's talk about binge eating. It's a phrase that gets thrown around a lot, right? But what does it actually mean? Well, today we're going to dig deeper than the usual myths to really understand binge eating disorder as the complex psychological condition it is. We'll break down the science and the signs, all to get a clearer picture of what it is, and just as importantly, what it isn't. Let's start with something I think pretty much all of us have done. You ever sit down with, say, a bag of chips, and before you know it, poof, it's gone. Maybe you were stressed or just zoned out watching a movie. Yeah, it's a super common thing. But, for some people, that experience is way more intense. And it happens a lot. That's where we get into the actual clinical definition of binge eating disorder, or BED for short. And we're not just talking about, overindulging at a holiday dinner. This is a recurring pattern, a real feeling of losing control, and then this wave of distress that hits afterward. This is really our starting point for understanding what this disorder is all about. All right, so let's get into it. What is binge eating disorder really? We're going to separate what's fact from what's just, fiction. You might think BED is a pretty new diagnosis, but the idea has actually been on the radar for a long time. I mean, way back in 1959, a psychiatrist named Albert Stunkard first started describing it. He called it something different back then, night eating syndrome, but the seeds were there. It's pretty wild that it took until recently for it to be officially recognized as its own thing. Okay, so this is a big one. A lot of people get confused about the difference between BED and bulimia nervosa. And it's understandable because they both start with binge eating episodes and that awful feeling of guilt afterward. But here's the absolute key difference. It's what happens next. With bulimia, there are what we call compensatory behaviors, things like purging. With BED, those just aren't there. And that's a massive distinction when it comes to diagnosis and treatment. And that brings up another really important point. Just because someone binge eats sometimes doesn't automatically mean they have the disorder. So where's the line? Having an occasional binge eating episode, that's actually super common for adults. The difference, the clinical line, is when it becomes a consistent, repeated pattern. We're talking episodes happening at least once a week for 3 months straight. And, crucially, it's causing real, significant emotional distress. It's that frequency and that heavy emotional impact that really separates it from just occasional overeating. Okay, so if it's not just a habit, what causes it? This is where things get really complex. And it's where we have to bust the single biggest myth about BED, that it's just a lack of willpower. That's not what the science says. Not at all. The truth is, science hasn't found a single on switch for binge eating disorder. There's no one cause. Instead, the experts see it as multifactorial, which is just a fancy way of saying there's a whole mix of things that come together to create the problem. It's like a puzzle with pieces from all different parts of a person's life. You've got biological factors, like your genes and your brain chemistry. Then there are psychological parts, like your unique personality and mental health. And then you have to layer on top of that all the social and even cultural pressures we face every day. So what does that actually look like? Well, psychologically, things like depression or really low self-esteem can be huge triggers. Biologically, there's some evidence pointing to things like hormonal imbalances. And when you look at the social and environmental side, a history of trauma or just that constant, intense pressure from society to be thin can play a major role. Okay, so we've talked about what BED is and its really complex causes, but how does a doctor actually make a diagnosis? Let's break down the specific signs and symptoms that professionals look for to officially identify the disorder. Right, so a diagnosis isn't just a hunch. It's a very careful process based on specific rules or criteria. These are all laid out in something called the DSM-5, which is basically the official handbook for mental health professionals. And inside those rules, there's a magic number to remember, and that number is 3. Why 3? Because on top of having those reoccurring binge episodes, a person needs to show at least 3 of these specific features. Things like eating way faster than normal, eating until they're uncomfortably full, eating a ton of food even when they aren't hungry, or eating alone because of shame. And then after the binge, they're hit with these powerful feelings of guilt and depression. It's that specific combination of actions and feelings that leads to a clinical diagnosis. And beyond all that psychological pain, we absolutely have to talk about the physical side of things, because the toll binge eating disorder takes on the body can be really, really significant. I mean, this isn't a small thing. The disorder is linked to a whole host of serious health problems. We're talking about a much higher risk for things like cardiovascular disease, type 2 diabetes, and high blood pressure, not to mention other issues like gallbladder disease, chronic pain in muscles and joints, and even insomnia. This just drives home the point that BED is a serious medical condition that really needs proper care. But, and this is so important, as serious as this all sounds, there is absolutely a path to recovery. So let's talk about that. Let's look at treatment and the road forward. The number one thing to know about treatment is that it's not a solo mission. The most effective way to tackle this is with what's called a multidisciplinary team. Basically, you bring in a whole crew of different specialists to help. So who's on this team? Well, it's a whole coordinated effort. You might have psychiatrists helping with any underlying conditions like depression. Nutritionists are key for helping rebuild a healthy relationship with food. And then you have psychologists or therapists who work on the behavioral and emotional side of things. It's a full-circle approach that, of course, also includes the support of family and caregivers. So the core of the treatment plan is really a multi-part strategy. First step is therapy, and often that's cognitive behavioral therapy, or CBT. It's all about figuring out and dealing with those emotional triggers behind the binging. At the same time, nutrition therapy helps create healthy, sustainable eating habits. And finally, bringing in some physical activity is great for managing stress and just improving overall health. It's a plan designed to heal both the mind and the body. You know, if there's one single idea to walk away with today, it's this quote right here. Binge eating is a psychological disorder and not a lifestyle pattern of an individual. Let me say that again. It's a recognized medical condition, it is not a choice, and it is definitely not a character flaw. And so that's where we'll leave you, with a question to think about. Now that we know BED is a real and complex disorder, how can we, all of us, start to change the conversation? How do we move away from judgment and shame and toward empathy and real support? It's a big shift, but it starts with understanding. And I really hope this explainer was a good step in that direction.